Good afternoon, Unite for Her. Welcome to our April Ask the Experts segment. So I am so excited to be here this afternoon. We have a wonderful topic for discussion, a topic that is new to us. We are so excited to bring this information to our Unite for Her community. So I will give our members a couple minutes just to hop on with us, and I'll do a little bit of housekeeping. So for those of you that may not know, my name is Erin Pellegrin. I'm our Director of Culinary Nutrition and Education. I work alongside our founder, Sue, to bring you our monthly education segments. And this month, our Ask the Experts topic is all about oral care and cancer with our expert from Side Effect Support. So we're really excited to have this discussion. We had some really wonderful questions that were submitted ahead of time. But please know, as we are streaming live on Facebook, for those that are tuning in with us, you are welcome to add your questions to the chat as well. As with all of our education events, this segment will be recorded. So if you know that you want to come back and re-listen to what we talk about, or if you want to share this with someone else, it will be available in our Her library. So I do want to take a moment to thank our sponsors for our Ask the Experts for this month. We certainly appreciate all of the support that our sponsors give us. So we bring you important topics and discussions each month. So our digital education events are presented by West, Merck, and Daiichi Sankyo, with additional support from GSK and Lilly. So we are so excited to have them, like I said, as our support each month, and being part of that community that brings us important topics relative to our members. So it's hard to believe that May is just next week. I'm not really sure where the month is going, but I want to give a little reminder about what we have coming up starting next week to kick off a new month. So we have our virtual hangout taking place next Wednesday, March 1st at 5 p.m. Eastern Time. And I will be joined by none other than Priscilla Fitzpatrick. She's the founder of Stronger Through Cancer. And she's joining us for National Physical Fitness and Sports Month. She will be leading a seated strength workout for all stages and talking about the importance of strength training and how it really can be accessible to all. Plus, I will be joining her and whipping up a protein smoothie and talking about why protein is a nutrient that is important for muscle recovery and restoration. So join us next Wednesday for that. And then on Thursday, we will be having our speaker series, and that will be at 6 p.m. Eastern Time. I will be joined by board-certified dermatologist and inflammatory breast cancer survivor, Sarah Marion Lucking, for an important discussion on sun protection and skin health. So it's definitely that sun protection time of year. Learn how to care for your skin during and after cancer treatment. In addition, we will have a special extra guest that will be kicking off our speaker series next week. We'll be joined by a representative from KESM, the UPenn campus. KESM is a nationwide community driven by passionate college student leaders that support children through and beyond their parents' cancer. Their flagship program, which is Camp KESM, operates free summer camps for children who have been impacted by a parent's cancer. They serve children who have lost a parent to cancer, have a parent undergoing cancer treatment, or whose parent is a cancer survivor. So she'll be jumping on with us to share a little bit about the local camp we have here in the Philadelphia area, but also how our national members can learn if there is a camp in their area. And again, all of these segments, including today, will be recorded and in our Her library, uniteforher.org/Her library. So with that being said, I want to jump right into our really important topic that we have for today. And I want to read a little bit about our expert that is joining us. So Jill Meyer Lippert is a registered dental hygienist, and she is the founder of Side Effect Support. Side Effect Support is an online resource for cancer patients, family caregivers, and healthcare providers aimed at reducing harmful Oral Side Effects of Treatments to Improve Quality of Life and Treatment Outcomes. She is the 2014 recipient of the Sunstar America's RDH Award of Distinction, holds a certificate of oncology management from the University of Southern Indiana College of Nursing and Health Professionals, and is an instructor for the National Network Healthcare Hygienist Oncology Certificate Program. She's a member of the Registered Dental Hygienist Advisory Board for the Oral Cancer Foundation and was named as one of the 6 dental hygienists you want to know by Dimensions of Dental Hygiene magazine in 2022. And boy, are we so thankful that we know her. Please join me in welcoming our expert for today, Jill Meyer Lippert. Thank you so much for being here.
Thank you, Erin. I appreciate the opportunity.
Oh, we're so excited about this. So I thought we would just start out, Jill, by really just kind of level setting the discussion today. Can you tell us why patients overall should be aware of their oral care? Why is it important?
Your mouth is connected to the rest of your body. And for years, that seemed to be something that just wasn't accepted. It is like the mouth was this separate entity, but we are learning more and more how interconnected everything is, and going into treatments with a healthy mouth can help to reduce your risks for side effects that can not only be uncomfortable, but they can cause complications in the treatment process. It doesn't make you immune to not having problems if you have a healthy mouth, but it does definitely reduce your risks. So it's important to not only think about oral health through your treatment process, but while you're keeping that in mind, it can help to preserve that quality of life through survivorship years too.
Yeah, absolutely. I love that. And really taking that long-term perspective to oral care, maybe not necessarily during treatment, but thinking of that months, years, far into the future for sure. Wonderful. Okay, so I know a topic that comes up quite a bit is about fillings. And I have certainly thought this myself just for general overall health. So if a person has silver fillings, which I know that I received when I was very young, is that something that maybe a patient wants to think about having removed or replaced?
So there's different thoughts about that in dentistry. Typically, probably the most popular consensus is that if they're not causing you problems, leaving them alone is fine. Sometimes what they realize is that while you're removing them, it creates an aerosol, and then you're stirring up that mercury. So if somebody does choose to have them removed, it's just very important that they have good irrigation and taking that aerosol away, the suction part of that. So just making sure that, and they could use something called like a rubber dam that helps to really isolate that you don't have pieces of the amalgam fillings falling into other areas of the mouth. So there's precautions that they can take. They have found that silver fillings last a really long time, but they can put a lot of pressure on the teeth. So a lot of times those teeth may be more prone to cracking as time goes on.
Ah, wonderful. Okay. So best to perhaps, if someone is interested in this, just ask if this is appropriate for them, if it's something that, they want to make as part of their long-term plan.
Yes. Talk about that with your doctor or with your dentist, I should say, and just make sure that they feel that that's the best route for you to go.
Love that. Perfect. Okay. On to another, I know, sort of hot topic, fluoride. So sometimes we hear that fluoride is toxic to us, and should we be avoiding it, whether it's in our toothpaste, whether it's in our rinse, or is it something that can support dental health?
So fluoride is still considered the gold standard for helping to prevent cavities and keeping the teeth strong. But there is a section of dentistry that is considered like a holistic faction of dentistry that they're not fans of fluoride. So it's something that is causing, I think, some confusion with the general public. And I am seeing a trend where more and more products are coming out and advertising themselves as being fluoride free. So I think there's a couple important things to understand about fluoride. First of all, is that you can get fluoride from a systemic manner or topical. So systemic is going to be if they add fluoride to your water supply. So if you have fluoridated water, That is really meant to be more of a benefit for kids as their teeth are forming, because they've shown when they ingest that fluoridated water, it helps their teeth form stronger. But once you're an adult, that fluoridated water isn't going to give you as much of a benefit because that your teeth have already been formed.
Yeah.
In those cases, you're getting the best effect by using it in a topical manner. So whether it be a toothpaste, a rinse, fluoride treatments at your dental practice, and there's different concentrations of that too. So the fluoride that you're going to get in your over-the-counter toothpaste is going to be at much less of a concentration versus the fluoride that you will have in a prescription strength or in the fluoride treatments that you can have at the dental office. So there's different concentrations with it, and it still is a really great way to keep your teeth strong. But I just feel that it's important that we as dental providers to be respectful, that if somebody, we can explain that. I'm a fan of using fluoride. I wouldn't hesitate with it myself or my family members. But if somebody isn't comfortable with that, I want to be respectful and give them other options of things that they can do. And sometimes it's other ingredients that can help to keep teeth strong, like nanohydroxyapatite, or using certain other ingredients to help cut down on those certain types of bacteria in the mouth that cause cavities. So.
Got it. And I'm so glad you mentioned that, because also as you're talking, I'm thinking, okay, absolutely, we want to respect and understand, a person's decision in terms of what sort of tooth products they use. So, toothpaste and rinses that do not include fluoride, do they have products in them that not only help to keep the mouth and the teeth clean, but support strong bone? And you're saying that some of those products do.
Yes, and that's a great reason that when you walk into the big box stores and you go down that toothpaste aisle, it can be overwhelming. There's so much to look at. And so it's really important to, discuss products with a trusted dental professional, because they can give you recommendations versus just taking a guess and pulling different products off the shelf. Because I know some of the things we'll talk about a little later is that not all dental care products are good for your oral health, which is crazy to think about. But sometimes they can end up causing other issues.
Yeah, absolutely. And the first thing that comes to mind, which I want to ask about, are mouth rinses and alcohol-free versus alcohol containing. And sometimes it's like, oh, I love the burn, I want to have one that has alcohol, but that may necessarily not be the safest thing or the healthiest thing for our teeth and gums.
Yes, and I think this is an area of dentistry that is really becoming interesting. We're learning so much, where years ago, there was this thought process of we're just going to kill all the germs. You use this, antiseptic, alcohol-containing mouth rinse, and you just kill all those germs off. But, the more we realize about this, the oral microbiome, you not only have harmful bacteria in the mouth, you have beneficial bacteria in your mouth, and you need those in order to have a healthy mouth. And if you are using those alcohol-containing antiseptic mouthwashes long-term, you're killing those good bacteria off as well. So that has really been a mind shift in dentistry that I think is going to really change products as we go along, that there's going to be less that are all killing all the germ type of a concept.
And I love that you mentioned that oral microbiome. In nutrition, we talk so much about supporting gut health and microbiome, but digestion, it starts from the mouth. It starts at top to bottom. And so creating that healthy environment starting in your mouth absolutely is really important. So so I'm not sure if our members often think about that. They have like an oral microbiome and there's healthy bacteria. So I love that you called that out.
Yes, and there's actually ways, I'm not sure if everybody would be aware of this. There are testings that you can do now to actually find out what kind of bacteria that you have in your mouth.
Really?
Yes, there's ones that sometimes dental offices may provide this, but there's ones you can do at home now. You can collect a little saliva sample, send it in, and they can send you back a full report on what types of bacteria they found and categorize it. Risk for cavities, risk for bad breath, risk for gum tissue problems, and then give more personalized recommendations on ways to help improve those areas.
Get out. That is so interesting. Okay, so we could certainly talk to our dentist or dental office to see if they offer something like that, or we could find that in the pharmacy.
I believe this mainly online, and I do actually have a link to one on my website as well.
Perfect. Perfect. And I know we're going to put the link to your organization in the chat as well. So be sure to look for that in the chat on Facebook, but we'll also be posting that along with the video as well. So I love that. Okay, so we know, obviously it's important, and we hear from a very young age about getting our teeth cleaned regularly. How about during cancer treatment? So if someone is in active treatment, or even in ongoing treatment, can they get their teeth cleaned?
That always has to be in respect to blood counts. There will be some oncology teams that will, as a blanket rule, say, once you've started any type of immunocompromising treatments, that you need to avoid going to the dental office. Others may say you can only go at certain times. So you might have to wait at a certain point in that chemotherapy cycle where it's safer to be seen. But if you are in treatments, it's a good idea about 24 hours before having your dental appointment, having those blood counts tested just to make sure that they're at safe ranges.
Excellent. Okay, really good to know. And that would be for those even with living with metastatic or recurrent sort of on ongoing treatment. They want to make sure that they're having those levels tested as well, not just for those with early stage that may be in an acute period of treatment.
And it's worth a discussion with your oncologist. Depending on what type of treatment there is, not all will cause those low blood count levels. We're most concerned about those white cell counts to fight infection and the platelets, that we don't want any uncontrolled bleeding.
Okay, love that. I know one of the things that I often hear, and one of the challenges that come up from an eating standpoint, is dry mouth. Some of the medications that they're on can have quite a significant drying effect. So do you have any recommendations or products that may help with dry mouth?
Yes, and dry mouth is so common. It's just, there's so many over-the-counter products or medications, prescription medications that have that as a side effect. And most of the time, people, when they're in treatments, they may be getting not only from their chemotherapy, but they may have like an anti-anxiety medication. They may be taking pain medication. There's all these different ways that all of a sudden it just compounds the issue. So probably the biggest thing to keep in mind is that there's just no one size fits all. I wish there was a magic bullet for dry mouth, but I have found very consistently that I'll have a product that works really wonderful for one person, and the next person tries it, and that just does not do the trick for them. Or you may have somebody that they find a product that really works well, and now their medications change, their body chemistry changes, and now this doesn't work as well. So the biggest thing is probably just being open, open to trying different products, not giving up. And I think that's for so many people, they may try 2, 3, maybe 4 products, and they don't feel like it's helped them. And they get frustrated and just assume it's something they have to live with. But I really encourage, if anybody has dry mouth symptoms, to be diligent and don't give up. Try to find something, because dry mouth is really it's more than a comfort issue. Without having those healthy protective elements of saliva, it makes people more susceptible to getting cavities, to getting infections in their mouth. It makes it more susceptible to getting mouth sores. So keeping that tissue lubricated is really important.
Okay. Do you have any favorite brands or things that you might recommend, at least to start off? Like, if this is a new adventure for someone, like, hey, start off with this. If that doesn't work, go here. Anything that you find in your professional practice?
Yeah. Is it okay if I actually show some specific ones, or should I just be more
Oh,
generalized?
sure. No.
Oh,
We love a show and tell. We love a show and
All
tell,
right.
Jill.
I've got some.
Okay.
So I am a fan of using dry mouth products that are based with a sweetener called xylitol. So xylitol is a natural sugar substitute that's made out of fibrous materials like corn cobs or birch trees. And it looks like sugar, it tastes like sugar, but it doesn't have the same carbon structure as typical sugar. So with regular use, the bacteria inside of our mouth that will consume the sugar to create the acid to make the cavities, they can't digest that. And it'll actually help to improve the oral microbiome by using xylitol products. So some of my favorite products. Spry brand is great.
Okay.
They've got toothpaste, they've got sprays, they have gels, and that really can be soothing to the tissue. Another ones that I like are Xylogel is a
Love
great
that.
one.
Hmm.
Xylamelts, which is a little disc that can adhere to the inside of the cheek and give more of a continual release.
Hmm.
There are different xylitol, all different xylitol type toothpaste, and there are some prescription options as well. One that is newer to the market now is a lipid-based prescription spray called a Quarrel. And being that it's lipid-based, it puts a bit of a protective coating. So it can be used on its own, or it can be used in conjunction with one of these other products to help kind of lock that moisture in.
Oh, that's great. Okay. And all of these recommendations, members can also find on your website as well. Am I correct in that? Okay.
Yes. And in fact, that is one reason when I created Side Effect Support, I wanted to put access to products on there because the more investigating that I did on this subject, I found that there are actually a number of dry mouth products that will make your mouth feel less dry. It'll relieve that symptom a bit, but it can actually cause damage to your oral health later on because they are acidic. I would compare it to so often I'll hear that patients will be told, oh, to remedy your dry mouth, suck on lemon drops.
Yeah.
But lemon drops, it'll make your mouth feel like it's salivating, but it's one of the worst things you can do from a dental health perspective because you're taking an acidic, sugary substance. So sometimes there are products that are kind of mimicking that, where they maybe don't have the sugar, but they're very acidic. So being that a dry mouth is so much more susceptible to tooth damage, and then you're making it an acidic environment overall, it really just increases their risk for damaging their oral health as time goes on with regular use.
So good to know. And those products for dry mouth, is it better to use them on an ongoing basis, or could they still be effective if it's just for a short period of time?
They will be most effective if they're used on a regular basis, and especially when you're talking about the benefits of the xylitol or another sweetener that's called erythritol. That is something that it takes, they say about 5 exposures a day is where you get that optimal protection for your teeth and to help improve that oral microbiome. And most of the time people will say, oh, 5 times, how am I supposed to get 5 times in? But again, it's, you can get it in toothpaste, you can get it in gums, mints. Those are a great way to help stimulate saliva. And so it ends up being pretty easy to get 5 exposures in a daytime.
Yeah, when you think of those different foods or different forms, I should say, for sure. So, okay, I love that. I want to go back to what we were talking about before, just sort of healthy dental cleaning during treatment, because we had a question from Facebook that came in. So, understanding during treatment, talk to your physician. Is that recommendation or guidance the same for those that are on immunotherapy?
It's still good to just always get your oncologist permission, just as a generalized rule. Typically, they will tell you. They probably won't wait for you to ask if they feel that it's unsafe. But even in those situations, just get their approval, make sure everybody's on the same page. One thing I think we need to improve on dramatically in the healthcare field is to have better communication between the medical teams and the dental teams. And if we can encourage that for our healthcare providers to have better communication, that's going to help us all the way around.
Yeah, I love that. I love that point. Something we definitely need to think about. Yep, for sure. So to that point, and a question that came in from one of our members ahead of today's segment, one of our members asked, when a person is on chemotherapy for a long time, say for a year or more, how can they best take care of their oral health when seeing a hygienist isn't an option? So any recommendations on things that we could just do ourselves if, getting to the dentist isn't something that is accessible?
I think the biggest thing is keeping your mouth as clean as possible, as gently as possible. That is one thing, Even when you're brushing, you want to make sure you're using a nice, extra soft, compact head toothbrush that you're able to access all the hard to reach areas gently without causing toothbrush trauma.
Mhm.
It can be tricky sometimes. I know, when people aren't feeling well, they're maybe nauseous. Wanting to brush is not really high on their list of things to do. But unfortunately, the more plaque buildup you have, the more likely you're going to have mouth sores and complications occur. So keeping everything as healthy as possible. There is the benefit now too that there are teledentistry services. So in that year's time, if you have questions and you need guidance, you can actually hop on a video visitation with dentists and talk with them about any concerns, get personalized recommendations. And not all dental offices offer that,
Mhm.
but more are. It's becoming more popular, but that was actually something that through Side Effect Support, I partnered with a company called the Teledentist. So through my website, people can access a what they call a synchronous
Mhm.
teledentistry appointment, and it's offered. You can see somebody within 10 minutes or less. 365 days a year, 24/7. So somebody wakes up in the middle of the night and they're like, oh, this is bothering me. You
Yeah.
can hop on and have that problem triaged in a bit and not have to
Yeah.
wait for your dental office to open or not end up in an emergency room situation. I think to me, that was the biggest thing. So many times people may hold off. All of a sudden they're going to an emergency room, and that's really not the place to have a dental problem evaluated
Mhm.
because that's not their area of expertise. Um,
Mhm.
it's better to talk directly to a dental provider.
Yeah, talk about peace of mind with that. I was
Yes.
completely unaware that that sort of virtual option was now being available, but so glad to know about that. And I'm glad also that in your recommendation, you said gentle. And
Mhm.
I think that that is really a great word to call out, because I think we really do want to be gentle with how we're working with our gums and our teeth. And brushing the I had a dentist tell me once I don't need to brush the teeth out of my mouth, and I thought, okay, I get it. That is a very clear description on I need to be more gentle. So I think that's really wonderful that you use that word.
Yeah. And especially during treatments, if you're susceptible to
Yeah.
getting mouth sores or the tissue's getting tender, um,
Oh,
we just have to be very careful. That tissue can get kind of fragile at times.
yeah, absolutely. Okay, we had a lot of questions come in about Xgeva. So, if someone's going to be receiving Xgeva and they were told they need to inform their dentist about that, about the start of this medication, can you just explain why that's important?
Sure. So Xgeva is a medication that has a risk. It's a low risk, but it's a real risk of a condition that's called medication-related osteonecrosis of the jaw. So
Hmm.
I can break that down a little bit of what that means. It sounds terrible when you actually define it, but it is death of the jawbone caused by medication. That's what medication-related osteonecrosis of the jaw means. So
Yeah.
again, it's not common, but it's real. So it's important that if somebody's going to take this medication, again, that their dentist is informed, that they're
Hmm.
treating them safely. The vast majority of cases of the osteonecrosis are caused or initiated at least by some type of trauma to the bones. So like an extraction
Okay.
or invasive type treatment like that. So
Okay.
if if somebody knows that now you're at risk for that, then taking certain precautions, first of all, hopefully avoiding having to do any invasive type treatment. That'd be
Hmm.
the first thing, trying to hold
Hmm.
on to everything as much as possible.
Yep.
Again, keeping everything as clean, as gently as possible.
Hmm.
And if an extraction would be needed, then, that isn't usually something that you'd want done in like a general dental practice. You would probably want to be seen at an oral surgery office that has some extra type of experience with dealing with that. So
Okay.
it's important that people just then are aware, okay, what are the signs and symptoms of it? So if something
Hmm.
does start, that they can be seen at an oral surgery office as soon as possible. or they can work with antimicrobial rinses. Sometimes they work with antibiotics and different types of procedures like that to help hopefully keep it under control.
Got it. So you mentioned Exgiva and affecting the jawline. Is there a long-term effect on teeth and gums as well? Or is it something that really starts with like the mandible?
It's mostly with the jawbone where the concern is, but it's very time and dose related. So the longer that this medication is being taken, or the higher the dose, the more that the risk is in place. There are other medications that can also have this risk, like Zometa is one of them. Avastin is another one. So there are other ones too. It's important, and in the ideal world, before this medication would ever be given to somebody, there would be a dental workup, an examination, make sure if there's a tooth that needs to be extracted, get it out before the medication is started. That would be ideal. It's just not always realistic.
Right. Okay. Could medications like that cause things like root fractures, like tooth root fractures?
I have not heard of it causing root fractures. Most likely, sometimes what happens is you have teeth that have already had a lot of work done. They maybe have had a big filling, they've had a crown, then they need to have a root canal, and then once you have a filling on a tooth, it can just get little like snowball into the amount of work that needs to be done on it. So, cancer treatments can cause a lot of stress. Sometimes people will clench or grind their teeth more. Sometimes if they are given an antidepressant or anti-anxiety medication, sometimes clenching or grinding can be a side effect of those. They can have dry mouth that may cause cavities around this that, all of a sudden they need all this extra work done. So usually, from my understanding at least, it's not the Exgiva that would cause a root fracture per se, but it's probably a combination of the history of that tooth and things that it's been through through the years.
Yeah, so really considering the history, like you said, of that tooth to really get a big picture understanding of what happened. Yeah,
exactly.
Okay. So one of the other questions that came in from our members about this was inquiring about dental implants and are they possible if it's known that there's metastasis to the jaw? Are you familiar with that at all, if that's a possibility?
It would have to be very case dependent on location, I think, but I would doubt that would be a prudent way to proceed in those areas, because the jawbone, again, you're initiating trauma in those areas with placing the implants. And it just would need to be really a case-by-case basis, but I don't think that would probably be the wisest way.
Okay. And if a person does need to have some sort of dental procedure, they are on Exgiva or one of these medications, and they have to take a pause, who is typically the medical professional to say when that medication should be resumed? Is it coming from the dentist? Is it coming from the medical oncologist? Who might a patient typically look to for that recommendation?
That would be another situation where I think it would be between an oral surgeon who has some specialized experience in this area and a conversation with that with the oncologist. And I think that needs to be more of a consensus versus a decision made by one professional or the other.
Okay, love that. And we had a great comment from Maria on Facebook. She writes, I'm on Exgiva, and that's one of the side effects. Fortunately, new studies prove that every 3 months have the same efficacy as with every 6 weeks. So perhaps a longer duration between treatments. Do we think that could potentially come with less of a risk of necrosis to the jaw? Or maybe it's just sort of too new in the study results to really get an understanding of how that may decrease risk?
I think there's a lot to learn with it yet. The medication hasn't been around, tremendously long. It's
Yeah.
it's long enough that we know that it's very beneficial
Yeah.
for extending quality of life. But that is something that I do think, again, going back to that dose time dependence on what the risks are, that if there's more of a chance to kind of space things out and you're still getting the benefit, I would assume that would take the risks down with it as well.
Yeah. Love that. Okay, moving on to some other side effects that one may experience involving the mouth. We also hear a lot that treatments can cause mouth sores, and that can be quite painful. Is there anything that our members can do to prevent this? And perhaps, do you have any other favorite products on what patients can use to soothe those mouth sores and that pain?
Yes. So oral mucositis is either going to be like just an inflammation of the tissue, a tenderness of the tissue, all the way up could lead to, big mouth sores. There's quite a range in what somebody might experience. So if in treatments with chemotherapy, even if we can't prevent it, if we can be aware that they're at risk and take some precautionary measures, we hopefully can help delay the onset. And then that way, because every time that you go in for another chemotherapy treatment, if you've had oral mucositis, you're that much more likely for it to occur. And it's just that much more likely to be more advanced each time. So if we can extend how far down in the treatment chain or in the cycles before it would begin, that is a great advantage. So some of the things that you can do are, again, keeping your mouth as clean as possible, as gently as possible, because the more plaque buildup that you have, any type of an irritation, that can start that inflammatory process in the mouth to lead to that. There are also certain chemicals that are present in different types of oral care products. Like there's a detergent called sodium lauryl sulfate that is very, very common. It's found in a lot of toothpaste. It's found in bath soaps and laundry detergents and dish soaps. It's something that gives that product this nice, thick, sudsy feeling, like you really feel like that toothpaste is cleaning. Unfortunately, for some people, it actually is a skin irritant. So that is something that could be a trigger for somebody if they are going to be susceptible to it. Another thing is treating the dry mouth, making sure that if you're at risk for oral mucositis, keep that tissue as lubricated as possible, because that's going to help prevent tissue trauma in those areas. And then also just looking at, reducing risk of trauma through food, like a pizza crust and, dry, hard, crusty things, keeping more of a soft, moist diet that can be beneficial as well. There is a product on the market now called Periovance, which was actually designed for to be used in the dental office for people that were having like gum treatments done and stuff like that. It's got a numbing effect, but this is something that could also be used in these situations to help people kind of get through that discomfort to keep eating possible. So that is an option. I'm not always that huge of a fan with numbing the tissue, because then you're going maybe at risk for like biting your cheek and things like that. So it's just something to be aware of. I don't think in those cases too that there should be like numbing. That a lot of times people will be given magic mouthwash. That's kind of something. It's a concoction that, there's different recipes. And I'm not always really a fan of that. It has its place for some people. It gets them through. But for other times, it almost seems like this knee-jerk reaction. We're just going to give everybody magic mouthwash.
Just numb everything. Yeah.
Yeah. And unfortunately, there's side effects with that too sometimes. People may have more taste changes. They may have burning of the tissue. Some people have GI issues when they're using it, or all of a sudden they're feeling, more constipated or have diarrhea. So I think if we be more selective on using those types of things with people, for when they truly need it.
I love that. Yeah. I know working in a hospital, magic mouthwash was always like, the go-to when we're dealing with patients, but it's good to know that we really want to be thinking about, like you said, sort of prolonging the time before when a person may be experiencing some of those side effects.
Yep. The more preventive we can be, the better. And that's always my battle cry. It's like let's not wait for the problem to happen. Let's recognize that there's a risk and then just take some simple steps to hopefully, even if we can't avoid it altogether, if we can minimize them, it's a win.
Absolutely. So we've had a couple questions come in just about, toothbrushing. So, is it better to use an electric toothbrush? I heard you mention like a super soft compact head toothbrush. What do you typically recommend we use?
This depends also on everybody's individual situation. I just have actually a couple examples of toothbrushes. So as I mentioned, it's ideal that you use an extra soft compact head toothbrush. So this one has a pretty big head. And most of the time, if you're going into your pharmacy or whatever, they're going to have a pack of toothbrushes that look something like this. And a lot of times they have medium hard bristles. But look at the difference in the size of the head. This is a post-operation brush. It's incredibly soft. Some of these are they remind me of like a baby's hairbrush. They're so nice and soft. And these tiny little heads are going to help make reaching in those hard to access areas easier and safer, that you don't cause toothbrush trauma. I think, as you mentioned, how your dentist had said, you don't need to brush the teeth out of your head. I remember when I was little, I was told, use a hard brush and get in there and scrub as hard as you can. And I'm like, that is not good advice. We don't need a hard bristle brush. These nice soft bristles work wonderfully. They help keep brushing possible if the tissue starts getting sore. Because if you're using one of those harder brushes, it's going to be a lot harder to keep brushing. And then just be aware that once you're using a real soft bristle brush, they're going to wear out faster. So you should replace them at the first sign of bending or fraying of the bristles. And you might be replacing it a lot more frequently than what you were used to, but that's okay, because this always has the potential of building up bacteria on it as well. And this, the more that you replace it, then you don't have to worry about that being a contamination source, especially in mouth sores. So one thing I wanted to mention, and I'll get to the electric toothbrush question, but so I'm a big fan of trying to keep the toothbrush from being a contamination source. So if you go into a lot of people's bathrooms, most of the time you'll see everybody's toothbrush sitting in a cup, touching each other.
Have you been in my bathroom? I'm not sure.
Not lately, but and realistically, this is a great way that bacteria, viruses, anything that's on this person's toothbrush now can transfer to this other person's toothbrush just simply by contact. And for most of us, it's not a big deal. But if you're in the middle of treatments and your white counts are depleted, this is a way that germs can transfer from one person to the next. And especially if you have open mouth sores, you want to be very protective of that. So I typically recommend people keep your toothbrush away from other people's. There are actually, these are one of my other favorite little devices. It's called an IntelliDent toothbrush shield, and it's a moisture wicking, breathable, disposable shield that can just sit over your toothbrush, and it helps to protect it against germs. Typically with bristles too, the longer they stay wet, the more they are apt to build up bacteria on them. So this helps to dry it out, but then it also prevents contact contamination. And then you think about storing it around a flushing toilet and things like that. Think about the things floating around your bathroom, which you might not want to think about, but you want to be protective of that too. You don't necessarily want that being exposed to that. Some people will say, oh, I'll put mine in a dishwasher, I'll put it in, soak it in a chemical of some sort to clean it. But then that can change the integrity of the plastic sometimes, or of the material. So that isn't always so great either. But I would say, as far as using an electric toothbrush, I really like mechanical toothbrushes. I think it's a great way to be more thorough in your plaque removal. However, again, if you are in the middle of treatments and your tissue's sore, your blood counts are low, sometimes those vibrations might be just a little too intense.
Too much.
Yes. So I would say just be cautious of that. And maybe, once you get into after treatments, after you're not at risk for your blood counts being so fragile, then moving more into an electric toothbrush. And the same type of thing to look for with those, compact head, extra soft bristles. certain ones that have different speeds, that you don't only have that option of it being just this intense, vibration, that you've got something that's gentle in there too.
Okay.
This one's kind of cool too, because then, and of course the battery is out, but this one has a little fail safe that if you put too much pressure, if you get too heavy handed, it'll stop vibrating. So there can be other features like that that are a good idea.
Yeah, I love that. And I love the reminder of sort of the cross-contamination and ways that we can protect the heads of our toothbrushes as well. So I love that you called out those products and just some things to think about. That's great.
Yeah, I would say the same thing too with when you're using your own tube of toothpaste. Once you put a ribbon of toothpaste on, a lot of people will take the end of that toothpaste tube and dip that on their bristles. And now technically the end of that toothpaste tube has been contaminated as well. So just an extra little simple safety tool is just using your own toothpaste.
I love that. I love that. Okay. I know we have just a few minutes left and we've got a few more questions I want to go through quickly if you have another moment, Jill. Someone put in a question. They wanted to know if they needed a mouth guard for radiation. So is that something that someone should be familiar with?
Typically, if the radiation is targeted to the head and neck, that would usually be when they're looking at doing some type of a mouth guard for it. Sometimes they will do that to shield things in some way, or to even displace certain parts of the tissue so they can put the maximum dosage to that specific spot and spare as much of the surrounding tissue as they can. However, if somebody's having general, radiation and other treatments that they're worried about dry mouth and they want you to have guards in order to carry a fluoride, that would be a little different reason for it. But typically, if radiation is in other areas of the body, I'm not aware that a mouth guard would be necessary for that.
Okay, wonderful. Another question, brushing in the morning and then before bed, if a person still feels like they're having bad breath, despite, kind of sort of following what we think of as good oral hygiene, what can we do, or what could be the cause of that?
It is important that everybody also brushes their tongue, which sometimes gets forgotten about. We have taste buds on our tongue that sit up almost like little finger-like projections, and bacteria can harbor down in those areas. And some people have longer, papilla or taste buds than other people, that it can be a little harder to keep the tongue clean. So they do have different tongue cleaners on the market too. This is one of them that is just a little plastic band, and it has teeth on each side. One's a little longer than the other one, and then you just fold it, and then you can use that to scrape down your tongue. And but that too is, if you're going to be susceptible to mouth sores, you want to take your extra soft toothbrush, make sure you're brushing your tongue real thoroughly. Sometimes you can actually, that's kind of nice with those oral microbiome tests too. You can test and see if they have more prevalence with certain types of bacteria in the mouth. Making sure that dry mouth is being treated. People with dry mouth are going to have that not so fresh feeling or have more of an odor typically. And then there are probiotics now that are available on the market too. So just like somebody takes a probiotic for gut health, there are lozenges that help to replenish more of the beneficial bacteria directly inside of the mouth. And that's, for some people, can be a big difference in breath concerns too.
Wow. Lots of options there. I love that. And I'm glad you brought up the tongue scraper as well, because I always wondered if that was something that was really beneficial, or was it just a little bit of a trend, but glad to know that that can be a contributor to good oral hygiene for sure.
Definitely.
And our final question, I think this is really interesting, just about the conversation with your dentist, because of course we want, just as we always say with our members, you want to have a great relationship with your medical team. You want to trust them. But we also, want to feel the same towards our dentist as well. So one of our members sent in a question, love this. How do you ask your dentist nicely if he knows enough about how cancer and medications and treatments affect your oral care, like length of time from healing, bone mats, dental implants? And if you're looking for a new dentist, are there some that are more knowledgeable for cancer patients? So any sort of specific recommendations for what to look for from our members would be greatly appreciated.
So this is a very, very common question. I do a fair amount of presentations for different cancer support groups around the country virtually, and it is almost every single one that somebody will say, you know, how do I find a dental office that understands my needs? And to me, it's so heartbreaking. That is something, though, that the reality is this is not something that is typically a big part of dental school training. There's parts of it, but it's not focused on. And of course, treatments and medications are changing all the time. So it really does take a provider that has an interest in it, that basically goes above and beyond to learn more about it. That is something, you know, I'd love to say there's a great tactful way to ask, you know, but honestly, it really will come down to you need to be your biggest advocate. 100%, you need to make sure that that you are being seen by the person who is going to give you the best possible care. And my thought always is that a provider should not be insulted by that. And if they are, that's maybe a sign that's not the right provider for you. You know, I think we all need to be aware that we've got a lot to learn, and we need to meet patients' needs where they're at, and that should be something that shouldn't upset us. And same thing as getting like a second opinion. Your provider should never be upset that you're getting a second opinion. They should welcome that. And if they don't, then I would question if that would be the right provider for me.
Okay, I love that. Good advice, good recommendations. And like you said, we are our own best advocate. So always worth just inquiring and asking and advocating for yourself. So thank you for that.
You're welcome.
Wonderful. Well, this was a world of wonderful information that you are shared. So Side Effect Support, it's sideeffectsupport.com. We will share that link. We've got great handouts that will be with our discussion today with Jill. She mentioned a lot of different products and tips. So please be sure to also check out her website for those guidelines and recommendations for different products for dry mouth, mouth sores. She is a wealth of knowledge. And Jill, we are so thankful for your time today. You know, thanks for taking your afternoon with us.
Oh, absolutely. Nowhere else I'd rather be.
Wonderful. Thank you. So with that, I want to thank everyone for tuning in. We had great questions. Again, this segment is recorded. So if you want to go back and re-listen, if you want to share this with someone that may benefit from all of the wonderful information Jill shared, please do so. It will be up in our Her Library, uniteforher.org/Her Library. And remember, we have our May events happening next week, kicking off May 1st, Wednesday, our virtual hangout. We're doing some seated strength with Stronger Through Cancer. And then we will be joined by a dermatologist to talk about skin health during and after cancer. So that will be Thursday at 6 p.m. Eastern time. I want to give one final thanks to our education sponsors. Presenting sponsor is West, Merck, and Daiichi Sankyo, with additional support from GSK and Lilly. So I want to thank you for joining us for a wonderful Ask the Experts to round out April. And hopefully we will see you next month for some more education and great discussions. Everyone have a wonderful afternoon.